Let's bring him in. He's been part of this morning show for over 30 years, and that's Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Dr. Joe, what do you have for us today?
Hey, Ray. I kind of promised when we were starting to see a lot more use of the Guardian cap in football that I've given update. You know, we started in 22, 23, seeing it more often. We definitely, being out on the field, you see it a lot more in 2025. And there have been a few studies that I wanted to update your audience who really keeps up on things in sports medicine well. So remember the Guardian cap. It's the padded helmet. The soft shell helmet is supposed to reduce the impact. People at the beginning, when it first came out, was called the mushroom cap. Nowadays, they have it matches the helmet, so it's not as easy to see if athletes have it on. But in the NFL, all 32 teams have access to wearing it. They have to wear it at practice. It's mandatory. In collegiate football, over 200. In high school, over 2,000 teams use the Guardian cap to some extent. So let's see what some of the studies showed. It's a little bit of a mixed bag, I have to admit to you. So what's the effectiveness with research? You know, I've always said through the years, we have to prove these things, not just clinically by saying, hey, I think it might work, is with research. So the 2025 research, especially coming from the NFL, is, again, really encouraging. And the NFL is really, really a big proponent. Their study this year in 2025, earlier this year, 54 to 62% reduction of concussions using the Guardian cap. Well, that's a big number, but they've been saying about 50% for the last couple studies they've done. They also looked at those lab studies to see if there's a reduction in the acceleration with the sensors, and they said that there's a fairly significant reduction. So with the NFL studies, it's pretty clear, and it matches back to the last big study they did, 2017, showed a 40% reduction. So in the NFL, no doubt about it. But another big study came out from the University of Wisconsin a couple months ago, mainly looking at high school players in that part of the country, 2,600 high school players. And they said that in their study, they really did not see a significant effect in reduction of concussions. So we have a couple different things going on here, some variable or inconsistent results. And one other thing is there were some really good college impact studies done at University of Georgia. It showed the impact was reduced by 9%. At Virginia Tech, the rotation, that's always been important to me, how much rotation of the head and neck, 3.8% reduction with the Guardian cap. So there's a lot of good evidence that it helps some, but then there's a big study that came out that not so much in the high school. So here's what I would recommend at this time. Number one, I see more players wearing them. They tolerate them well. There's no question that kids don't mind wearing them. They tolerate them well. I'm seeing almost whole teams that wear them on Friday nights and on Saturdays at college games. So it's not a problem with tolerability. Number two is there's a lot more kids asking them to wear them, especially after they've had a concussion. I think that's a time where it gives them a comfort zone. And so that's helpful. I think number three is maybe my biggest point. As the season goes on, and I've told you this before, like with other injuries, musculoskeletal injuries as well, is there's a lot of kids that get this cumulative effect of kind of getting hit in the head. They call it kind of a subconcussive blows. Hits to the head that don't add up to a concussion, but these cumulative effect kind of things. And many more kids with that type of effect are asking to wear the Guardian cap as the year goes on. I've seen increased usage, maybe doubling with many teams, of kids asking to use them. So, of course, with other things that we're using to try to reduce concussion, I think the Guardian cap still has a role, and I feel pretty strongly that we ought to continue the use right now and watch and see where it goes. And I think we need to continue the studies as well. But my recommendation is I think there's enough evidence of the benefits of the Guardian cap that I'm in favor of continuing using them.
You know, Joe, with the benefits, certainly when you talk about the medical side, that speaks for itself. I also think, and you brought up something, cosmetically, the guys don't mind wearing these because they match more with the regular helmets than those old little caps that you almost used to glue on, your regular helmet. And as weird as that sounds, I think that matters to these guys playing the game. So whoever put the Guardian cap together took that into consideration. And I think that also has something to do with it. One, the safety, and number two, cosmetically, these guys are accepting it as well.
For sure. It's not like the big old puffy thing that they started in the late 2017s either. It's just a soft shell, padded thing, and it matches well. And I can't even tell sometimes. All I know is the usage has gone up and up from week 1 to week 11 in high school, and that tells me the kids kind of are asking to wear them. And so I think we ought to continue to look at this piece of equipment that could help kids, I think, down the road.
No doubt. Joe, great information as always, my friend. Thanks for bringing it with us on Wednesdays, and we'll do it again next week.
All right. Sounds great, Ray. Have a great week.
You too, my friend. Dr. Joe Kimjini, he's the best. And as I mentioned, he's been part of this morning show for over 30 years right here on WAKR.